cannot affect one without affecting the other. And so I help people start where they feel most comfortable, because I happen to be able to do all three of those because of my background. But I do find, as you said earlier, oftentimes starting with the body is a very safe place, because they're simply doing exercises. And most people are familiar and comfortable. Exercise is not a threatening word. And I discover if you calm down the body, it's easier to access what you're emotionally upset about. Sure. And the perfect example of that is you could be disturbed, you could be angry about work, but you go to a good massage therapist, you get a nice massage, he or she may not have talked to you for the entire hour, but when you're done, you just feel like the anxiety that you came in with no longer exists. That's in your thinking as well as in the way you feel in your body. So they made an intervention in your psyche, but they didn't talk to you at all. They simply relaxed your body. So that's a perfect example of how you could start with one but still affect the other.
And this can be a problem, especially in Western cultures, where people get their degrees in shrinkery. My professor friend John, who's a professor emeritus, says the problem with a lot of these Ph.D.s is when they get it, they stop learning.
Right.
And they think this, and they get to be so articulate, and they teach their patients to articulate, and yet they're always one step ahead.
I actually appreciate counseling. I think it's very useful at times. I don't believe it entirely can help people heal, but I'm a counselor, so if I start with body work, sometimes having the skill of helping the client be able to know how to articulate what's going on in them, and knowing something that even they're not yet aware of, but I know they will become aware of, is very useful. So I think that the whole field of Freudian psychology and psychoanalysis that grew up was a tremendous contribution to understanding the human being. The mistake that we make, and we always make as humans, is for a while we thought it was everything. And so we threw out the body as having any viable access into the mind. And now we're starting to bring that back in again, and we're recognizing that not are we just dealing with psychology when we're dealing with trauma, but we're dealing with neurology. And neurology is nothing but a transmission of signals in the brain. Has nothing to do with anything except how does the brain transmit signals. And we know that a traumatized brain transmits signals differently than a person who does not have trauma in their brain. And so in that regard, we're still looking at the body rather than looking at what we call psychology or the mind. There's a difference between the brain and the way it functions and the mind. And so now we're getting more refined in knowing how to deal with trauma. And we're recognizing that all the time, talk therapy, it does not bring complete resolution of trauma for many people. And that body work and sometimes introducing their belief system also helps contribute to the healing process.
And we must remember, most people think Freud was a psychiatrist, but Freud was a neurologist.
Right, exactly.
And the street story goes that the real intervention of the day was actually hypnosis. And I don't know if this is true. Freud did his cocaine thing. He believed in that. And the wooden false teeth used to get loose. So he decided to shut up and let them talk. And Milton Erickson, who came later, God bless his soul, in 1958 got hypnotherapy in the mainstream, accepted by the AMA. I don't know how he did that. He was very charming. Actually was a storyteller, a metaphor master. And I know people who were with him at that time who said, because of this polio thing he had, and he was dyslexic as well, every morning he had to hypnotize himself for 2 hours to get the pain under control. So maybe in a way he was going into this all the time.
Maybe. I don't know his history as you've just explained it. Stories, but what I do like is that we did develop from a Western perspective a movement towards helping the individual heal. Our only problem was that we then sort of claimed it to be the only way, which it isn't, and now we're again readdressing it because we're discovering it isn't as effective in working with trauma.
And societies and groups can have regression. We can have group trauma.
Right, exactly. Mass trauma, what we call our cultural trauma. We saw that in the United States with Hurricane Katrina, with 9/11. where you have hundreds of thousands, if not millions of people traumatized by a single event, whether they were in the event or not. They experienced some traumatic experience by watching it on TV or knowing a family member or a friend who experienced it. So for every one person who's traumatized, there's about 7 other family or friend members who are closely connected to that traumatic event as well.